Joining us is Dr. Doyin Oguyemi. She's a public health physician, and she's going to talk to us some more about the school resumption measures. Thank you for joining us on the program.
Thank you for having me.
All right, so reading through the guidelines from the NCDC, there appear to be several measures students, staff, visitors should take before leaving their homes, getting to school, and of course, what they need to do when in school, and of course, the other non-pharmaceutical measures. But there's something that I noticed. Take, for example, Ekiti State. Ekiti talks about resumption in phases. It says September 21st, the SSS2 and GSS3 and Primary 6 resumes. And then the next batch, you have the SS1, GSS2, Primary 5 and 4 resuming like 7 days later. Do you think there's a science behind that? And when you compare it to, COVID-19?
Well, not all schools use the 7 days, but there's something around 7 days. So if we look at the natural history, if somebody is infected on, say, day 0, normally they get symptomatic about day 5. And that symptom goes on till day 7 and afterwards. So the most contagious time, the most infectious time is around day 7. Just before or after, somewhere around before the symptom and just after the symptoms have started. So essentially, that's where the 7-day thing came from. That if at 7 days there is no symptom at all, maybe the person is not positive to the virus. So that's why. Before we said 14 days, and 14 days is really calming because you're sure you're completely out. But it was difficult to comply with. So why not to ensure a bit more compliance, let's say 7 days. But people have said, let's stretch it to 10 days. And if people are symptomatic, they must wait 3 days after the last symptom before they are declared fine.
Another thought is, for a state like Ogun State, saying that primary 1 and 3, 8 a.m. to 11 a.m., and then you have primary 4 to 6, 12 noon to 3 p.m. I know what comes to mind is physical distancing.
Yeah. So again, and that's why I say it's not fixated. Every school, every state, and they are all tailoring to what works for them, vis-a-vis what their school environment looks like, number of teachers, number of pupils. The important thing you want to gain from phased resumption is, 1, physical distancing. So there are fewer pupils at the same time at once. Secondly, you want to reduce the pupil-to-teacher contact as much as possible. And then you also want to be able to pick up people if they have issues. And at least with phasing, when you start out, you know what to do. It's like a bit of a test run. And then you're able to know how to work with other students when they come in. So again, some are doing morning, afternoon, some are doing alternate days. The whole idea is what is in your school. How are you able to keep that distance? Some people may even be doing outdoor learning so that can be achieved. So let us know what is to be achieved as much as possible. And if we do, then each person can tailor it to meet their positions.
Your advice to parents and guardians who, will be taking these kids to school and they'll be coming back home, what would that be?
So I presume there will be some anxiety, which is normal. But I will say that there's been the SS3 who have gone, and they've kind of ended their exams or almost ended now. And we didn't see too much in terms of spikes, but everybody still has to be cautious. So before children leave, please let them have their own face mask. I don't know, we need to probably put names, especially for the ones that are in the younger classes. Let them wash their hands before leaving the house. The same thing will be done in school, I'm sure. And please, teachers should model good example. Don't tell children do this and you're not doing the same. And then teach them to wash their hands frequently and let them know the importance of why we're doing what we're doing, and we'll be fine.
We appreciate your time. Thank you so much, Dr. Doyin Oguyemi, public health physician. Thank you for joining us.
Thank you for having me.